John Muir has always tried to push the envelope in terms of having the best treatments available and being somewhat of an early adopter, especially for treatments that we see as being especially effective.
Technology doesn't work without, good basic fundamentals in clinical medicine, such that you and your loved ones and your friends and everybody else who comes through John Muir is going to get excellent care.
Every area needs to have a hospital to provide advanced, sophisticated, and usually difficult treatment options. And in this neck of the woods, John Muir is it.
So we really help people at some of the hardest times of their life. And we help them, adjust to life-altering diagnoses.
The biggest thing I think a lot of people fear in their life is not so much length of time you live, but the issue of not ending up with a neurologic disability taking place.
In June of 2015, I got this momentary, really fine tremor. And as the symptoms progressed about a year and a half ago, it was starting to really become a problem, as well as really uncomfortable for me and getting embarrassing. I got up early in the morning and I was shaking really bad. It threw me off balance, so I would bump into walls and doors, and I thought, what's going on here? Why are my tremors so bad? It was terrible. I cried. Every day I cried because I thought, my life is over. I had no retention capability. I couldn't write. Essentially, everything that I like to do in my life, I couldn't do. So I said, I'm completely disabled from this disease unless something is done.
My friend Joel and I got together, early morning hike, 100 feet up the trail. I just kind of stopped. And I said, Joel, maybe we could take a break right here. And I tend to wait for other people to take breaks generally. And then I told him, I think I need to sit down. He said, do you want me to call 911? I said, not yet. No. And then I felt some tingling in my left arm, and I'm like, call him. They pull me in, and they ask me questions, and I think I'm answering these questions in my head, but clearly I'm not able to. And so Dr. Finch came in before the procedure and told them, what he was going to do. This could be months before we know how good or bad things will be. So I'm going to do my best to get the whole blood clot out. We don't know. Sometimes there's small pieces that, that break off and go into different parts of the body and the brain. Prepare for the worst. About 20 minutes later, he came back in and he said, people, that was the fastest blood clot removal I've ever done. And I got it all.
So somebody gets a stroke, and traditionally they would just suffer the consequences, and they'd be paralyzed on one side or unable to speak. Nobody wants to live that way. Now we have the ability to almost go into a time machine and reverse something that's already happened. And since time is of the essence in a stroke, that makes a big difference in their outcomes.
Claire and my kids are there. It was probably half an hour after the surgery. I wake up, people come in, and I'm talking, right?
We have a lot of good medicines for both Parkinson's disease and for essential tremor, but when their effect stops working, deep brain stimulation can sort of give people their lives back, give people a lot of their function back.
So I have the impulse generator is here in my chest, And that's what sends the signals to the stimulators in my brain.
So by applying a little bit of electrical energy in a specific part of the brain, we're able to stop the tremor, stop the movement problem.
I can feel it when I turn it on. It's like this little vibration in my head. See, now I feel like this momentary tingle. It's like you can just feel it, and then the tremors go away.
As we've gotten more skilled and intelligent about doing these procedures, and as the equipment has gotten better, the results have improved.
What is crystal clear is that the neurosciences is intertwined with technology. So financial support supports that technology.
Here at John Muir, with community support, we can provide really high-level medical care and recommendations, but also make sure all of those great ideas translate into changes in patients' lives.
You know, that's the thing, is any investment is a big deal. It's altruism, you know, in the sense that you're trying to do something for the betterment of your community.
I'm the result of like all this wonderful new technology. So I owe a lot of my ability to walk and talk right now to John Muir and what's been done so far.
Thank you so much for giving to our health system. And your support of neurosciences at John Muir not only give me my life back, but it's going to be an opportunity to give somebody else their life back.